ask if you can all mute yourselves so that we don't hear any background noise. There will be some opportunity to make this interactive, so we will ask you for some questions and we'll ask you to participate via the chat, or you can use the raise hand feature so that you can raise your hand and we'll call on you if you want to speak. But if you're not speaking, can you please put yourself on mute? All right, and I just wanted to give a little bit of background. We wanted to provide this training from the 3 departments because we recognize your important role in the field or virtually that you have in bringing necessary information in the communities that you work in. And we know that information is key in helping to ensure the health and well-being of those communities. So we would love if you can share any information that you learned today with others that you work with, or anyone in the community. So we appreciate all your hard work.
Leslie, you're on mute.
Oh, sorry. Did you guys hear my check-in?
Not yet.
Okay, I was just saying that we are doing a quick check-in, so if you could please participate via the chat. If you could find the emoji that is most appropriate for you, and depending on how you're feeling today, and then I'll wait for a few of your responses. Thank you all for participating. I am enjoying looking at all of your emojis, and I'm glad to see a lot of happy faces. Okay, sorry. All right, so we'll start with discussing prevention. Can you all, we've been in this for over 6 months now, so can you all just say, in the chat, a few things or one thing that you've done to stop the spread of COVID-19? Tell us what you've been doing, and then I'll start the discussion. Thank you all for participating. I'm seeing that a lot of you already, we've all kind of heard this information, but just to reiterate, one of the main things that we can do is to stay home as much as possible. Obviously, that's not always feasible since we have to go to work, we have to go to our doctor's appointments, go to the grocery store. But when you do go out, taking the appropriate measures, such as washing your hands frequently, wearing your face covering or your mask, avoid touching your face, eyes, nose, mouth, and cleaning and disinfecting objects very frequently. So thank you all for your participation. And just to reiterate, because of the way COVID spreads, it is really important to wear your mask every time you go out. All right. This slide here shows us some things that we should be doing when we wear our masks. Why do we wear our masks? Because of the way COVID spreads through respiratory droplets. So we want to make sure that we're able to cover our nose and mouth to limit the spread of COVID-19. We also touch our face less when our face is covered. So it's kind of a reminder to not touch our face. So these are some some things that you should be doing, such as washing your hands every time you're going to touch the mask, making sure you're wearing it correctly so that it covers your whole mouth, nose, and chin. And also washing your hand when you're done with the mask, throwing it away if it's a disposable mask right after you're done. And if it's a reusable mask, you can make sure you store it correctly, and then take it home to be washed, and then using a clean mask every time you go out. This slide here shows us some things you should not do with your mask, like wearing it incorrectly, touching it, and then discarding of it incorrectly. And, definitely no reusing and not sharing your mask with others. So these are all things to keep in mind when using your mask. All right, so who is at risk? There are certain populations that are at higher risk of getting severe illness from COVID-19. So some people become very sick when they get COVID-19, not all. Some people do have no symptoms and can seem to be perfectly healthy and can still spread COVID. So that's why we all have to take the necessary precautions because not everybody shows the illness in the same way. But of course, we want to protect those populations that are more vulnerable for serious disease or to get serious symptoms from the illness. I'm sorry. All right, and here we can see some numbers of this graph shows the mortality rates of COVID-19. This is the age-adjusted death rates per 100,000 people. So as you can see here, the main point from here is that we can see that communities of color have higher rates. And this highlights a history of racism and unequal access to healthy environments, opportunities, and resources that have existed in these communities that um, and, this isn't new. This happens with other diseases such as, we see these numbers with diabetes, with asthma, heart disease, all these things we see that communities of color are disproportionately affected. And it's the same trend that is happening with COVID. So because you all work with communities of that are most affected and that you have a major role in bringing necessary information to these communities to help slow the spread. This slide here shows, now that we are starting to go out a little more, there are some things that we should be doing or keeping in mind when we go out. One is avoiding crowds. We definitely want to avoid confined spaces, especially those with poor ventilation. If possible, visit places that have outdoor options instead of indoors. Right now, there's not too many options that are even open for indoor, but there's restaurants that have outdoor dining or shopping malls that are outdoor that are open. Those places are safer than indoor because they're not confined spaces. And if possible, try to avoid crowds and keeping your distance when you are out, keeping your distance as much as possible from others that you don't live with. And then, of course, taking into account all the measures we talked about previously, such as washing your hands often and making sure to have your cloth face covering or your mask at all times when you're around others. So families, how can families stay safe? Even though, right now we all miss our friends and family. We haven't been around them for a few months now. Gatherings in the home or anywhere with others who don't live with you are still very high risk. We should avoid having visitors in our homes other than those who provide essential services. So, somebody who's doing like caregiving. So, it's again because of asymptomatic spread, somebody can look perfectly healthy, and we should try to avoid at all costs to be around people who may have COVID-19. Okay, and this is for workers. So now that a lot more people are going back to work, these are two important phone numbers to share with people in the community. One is for employers. If they see that there is an outbreak or if they know of staff that have COVID-19, they are required to report it to the Department of Public Health. So that's one phone number where an employer can report an outbreak of COVID-19. The next one is workplace safety. So all work sites are required to follow certain infection control protocols, such as physical distancing, wearing of face coverings for both visitors and employees, cleaning high-touch surfaces. If you or somebody else sees that the employer is not following public health protocols, there is a number where you can anonymously report, so they won't know your name, or so you don't have to be afraid of any retaliatory action. You can report anonymously to the number, and public health will investigate. All right, now I'm going to pass it to my colleagues from the Department of Health Services to discuss testing. Thank you all.
Okay, great. Hi, can you hear me?
Yes.
Okay, great, perfect. I'll jump in though. My name's Anna Gorman. I work for the Department of Health Services. And thanks so much. I see there's lots of participation and people commenting. We're going to keep you involved throughout the presentation, so thanks. So there are about 180 testing sites across LA County, from everywhere from Dodger Stadium to Antelope Valley to Pomona. And there are currently lots of appointments available. Demand is down right now. So if you do need a test, we definitely want you to be able to get it. It's a simple online registration process. We want to make sure you all know a few things, though. We are reserving testing in LA County for people who really have a reason for it. And you should, one of the reasons, of course, is that you have symptoms. You shouldn't, however, go seek out a test if you just want peace of mind, if you just want to know whether or not you have COVID. And you also should not be required by your employer to get a test to go back to work, or negative test result to go back to work. We also want everybody to remember that getting a negative COVID test does not mean that you are protected from the virus. It just means that you were negative at that moment where you got tested. You could have been exposed that very afternoon after you got tested. So please follow DPH's guidance on protecting yourself and preventing the spread. Next slide. Who should get tested? Like I said, we are reserving testing for those who really need it. So only certain people should get tested. We are prioritizing those who have symptoms, as well as those who have been exposed to someone who has COVID positive. LA County is also prioritizing testing for people who are high risk, like those who are homeless, or people who are living in places like nursing homes or group homes. When I say close contact with somebody who's been in close contact with somebody who had COVID, or exposed to somebody who had COVID, that means you were within 6 feet of that person for more than 15 minutes. Those people should also get tested. And finally, LA County is testing essential workers, even if they don't have symptoms. So those are people who work in healthcare, emergency services, grocery stores, or public transportation. Next slide. We've learned a lot about COVID symptoms in the last few months. We know some of the most obvious ones: cough, fever, shortness of breath, or nausea, but there are a lot of other ones as well, including new loss of taste or smell, or chills, sore throat, congestion, runny nose, and we keep learning more and more about the symptoms every day. Please keep in mind that the symptoms don't always appear right away. You may have been exposed 4 or 5 days ago, and then they just show up today. So symptoms may appear anywhere between 2 days and 2 weeks after being exposed to the virus. Also, please remember that someone who does not have any symptoms may still have COVID-19. Not everybody has symptoms, even if they are positive. Next slide. Next slide, please, Leslie. How to get tested and what testing is available. I actually think we flipped over one. There we go. Thank you. So how to get tested. There are 3 easy steps. The first step is to call your doctor. It's always best to check with your doctor or your healthcare provider to determine the kind of care you need. Your primary care provider can also provide you with information about how to access testing. They may be able to test you themselves. The second step, if you do not have a doctor, call 211 and they can help connect you with a doctor. And finally, number 3, if you do need testing and you can't get tested through your doctor or your healthcare provider, then visit our website, covid19.lacounty.gov/testing, and you'll be able to find a testing site. In a minute, I'm going to show you our testing website and demonstrate for you a little bit about how to find a test. All right, next slide. All right, very, very important because there's been some misinformation about this. Testing in LA County is free, and it is free regardless of immigration status, income level, or insurance coverage. So anybody who meets the criteria for testing based on symptoms or on the categories that I went through before is able to get a test. And we want you to know that this is not going to affect your immigration status. You can get tested no matter what your immigration status is, and it's not going to affect public charge. The information we collect will not be shared. LA County does collect information about insurance because that helps with reimbursement for the county, but it does not, your personal information is not going to be shared. And even if we ask for your information about your insurance, we are not going to charge you for a test. If you have any questions about immigration status and COVID, please call the Office of Immigrant Affairs and call or reach out. Their website is listed here. All right, I would like everybody now to take a second to type into the chat if you know where a nearby testing site is. So if you know where you could get tested, if you need to get tested, just type yes or no. And if you want to type in where your location is, that's good too. If you know there's a CVS near you or a health clinic, oh my gosh, this is great. Look at all those yeses. I love it. All right, next slide. I'm going to show you, if there are any no's, I'm going to show you how to find your testing site. But I hope that you all will take this out into the community and really guide people how to look for testing sites available to them. Testing sites are available whether you are in two different ways. You can walk up to some sites or you can drive through to other sites. So if you don't have a car, that should not prohibit you from being able to get a COVID test. You can walk up to some, and it shows on our website which ones are walk up and which ones aren't. So if you could press play on the short video. All right, so here's our testing website. It's covid19.lacounty.gov/testing. You type in your address where it says enter your location. And the testing sites that have spots available will pop up right there at the top of the list. So you see here near downtown, there's Dodger Stadium, there's St. John's, there's the Mexican Consulate. It shows how close it is to you. It shows you can filter by walk up only. And there's a lot of information here too about how to make an appointment, where to get, if they test minors, how to get to the testing site. All right. You can stop the video. We're also adding a little bit more information on this map too about what languages are spoken at the site and if they're wheelchair accessible. So that's coming soon. Next slide. Testing results come quickly. They should be anywhere between 3 to 5 days. And the test itself only takes a few minutes. I want to share what happens after you test, positive or negative. If you test positive, it's very critical that you isolate yourself. We've heard a lot about these two terms, isolation and quarantine. I'm going to talk about both. And I know before COVID, I wasn't entirely clear about the difference between the two. Isolation is to separate people who are infectious with COVID-19 away from people who are not infected with COVID-19. If you test positive, or you had symptoms, you should stay home for 10 days until 10 days have passed since your symptoms started, and you've had no fever for 24 hours, and your symptoms have improved. So those three factors: 10 days have passed, you've had no fever, and your symptoms have improved. This is so you don't spread the virus to other people. Now, if you tested positive for COVID, but you didn't have symptoms, you're still infectious. So you should stay home for 10 days after the test was taken. And if you develop symptoms, then you follow the instructions above, that you wait till your 10 days until your symptoms, after your symptoms were started. If you can't isolate in your home, and we know that that is difficult for some people, lots of people live in crowded apartments, there are what are called medical sheltering beds available. You have to get a referral for these beds, but you can talk to your healthcare provider, you can call 211. If somebody lives in a homeless shelter, they can ask the homeless shelter. These are available to help, again, prevent the spread. If, however, you're having a medical emergency like chest pain or problems breathing, isolation or a positive test should not keep you from calling 911. If you're having an emergency, just like before, you should call 911 and go to the closest emergency room. Next slide. Quarantine. All right, so quarantine is a little bit different. Quarantine is to separate people who have recently been exposed to COVID-19. If you're positive, then people who have been close contacts of you should quarantine. So if you're positive, you test positive, you isolate. Your close contacts should quarantine. So those are people who have been within 6 feet of you for more than 15 minutes, or who've had unprotected contact with your bodily fluids. So if you shared a drink with somebody, or you shared you shared food with somebody, you took care of somebody without masks, you had a hour-long conversation in your front yard close by with a neighbor without masks, those are all people who need to quarantine if you test positive. Again, if you're having an emergency, however, still call 911. Next slide. Contact tracing. So type in the chat if you had any idea, yes or no, what contact tracing was before COVID. And be honest, this has been something that's been around for a very long time. Yeah, I didn't either. So I'm glad to see a lot of no's, but we're learning a lot about it. So let me explain what contact tracing is. It's a confidential process that public health departments have used to slow the spread of diseases and avoid outbreaks. They basically, public health officials want to find out who's been exposed, right? Who has COVID, who tested positive for COVID, and who were the people around them, so that those people around them can get informed about a friend of theirs who tested positive, or a close neighbor that they've been close contact with who tested positive, and tell them, look, you may need to get tested too. The more people that the more people we know about, the more people that we can prevent from getting COVID. So if contact tracers call you, or one of the people you're guiding or helping, you're one of your clients or patients that you're working with, please inform them and advise them to answer the call. It's really, really important that they answer the call and answer a few simple questions. Some of those questions are shown on the next slide, but talk about how you're feeling, or how you've been feeling, or who you've been around. And then the public health officials will let you know what to do based on your risk for developing COVID-19. Next slide. Thank you, Natalie, putting in her comments of what contact tracing is. That's great. Again, some of the questions I mentioned. So maybe additional questions are, tell me about the place where you live. Do you live in an apartment, in a house? Who else lives there? Who else stays there? When were they there last? How many children do you have? What other children might be in the home? These are all people that may have been at risk of, may have been exposed to COVID and may need to get tested. Contact tracers are not going to ask for bank information or social security number, so you can let people know that. And again, this information is confidential. It is used simply to stop the spread of the virus. Thank you. Next slide. Okay, so that is our portion from the Department of Health Services on testing, and thank you for everybody's participation. Hopefully you learned a little bit about all of these sort of complicated topics of isolation and quarantine and contact tracing. I'm now going to pass it over to my colleague at the Department of Mental Health, who can talk a little bit about how the pandemic is affecting us and how we can get through it together. Kara?
Oh, hi. Thank you, Anna. And this is Karis Myrick. I'm the Chief of Peer and Allied. Uh, oop, I'm sorry. Can you all hear me?
Yes.
Okay, sorry. I thought I heard something. All right. So I'm Karis Myrick, and I'm the Chief of Peer and Allied Health Professions for the Department of Mental Health. And so we've learned a lot of different things about what is COVID, how do you contact, how do you keep safe, how do you get the virus, and then also what is contact tracing. All of this can raise a lot of emotions for people. So we'll talk about how do we get through the emotional part of the pandemic. Next slide, please. So when I talk about our emotional health, yes, that is also our mental health. We all have mental health. So what are some of the things that impact our mental health? I would really love it if you all could type in the message box either things that you know about that are impacting, the people we serve, their mental health, or your own emotional health and well-being. Like, what are some of the things that are impacting it? You can just type that in the chat. So, for example, on the slide, we have grief and loss, fear of getting COVID. It's like this invisible thing, so it can be very scary for people. Separation because of the physical distancing. Though we can keep socially connected, we do have to be physically apart. Like my father's in Florida, and I haven't seen him for months, and generally I would have seen him by now. Financial, this is affecting people financially. Either their work has changed or they've lost their jobs. The fact that we have to be in lockdown or quarantine. Now that school is back in session, many kids and adolescents are doing school at home while also the parents are at home, maybe trying to work, and that can cause extra stressors. Maybe there's less emotional support. Or maybe there's just so much information, and I hope today is not one of those days where we get information overload, but sometimes there's just so much information and we have to call through what is accurate, what is not, and of course things like unemployment. You all are typing in some really great responses as well. Loss of loved ones, not getting to see loved ones in care facilities. Exactly. We could currently have family members who are using drugs and alcohol to cope with this time. Great. You guys have put in some really great responses as well. So thank you. Can we go to the next slide? So all of this, increases our stress during the pandemic. So you all have spoken to some of these things that the stressors can come from, like fear about health, about ourselves and our loved ones. And then it can also affect our sleeping and eating patterns. So sometimes, we may be sleeping too much or too little, or eating too much or too little, or eating differently because we can't always get some of the foods we're used to getting pre-pandemic. Bouts of anger, like controlled anger, can be very hard to concentrate. I think somebody also mentioned before, maybe increased use of alcohol, tobacco, or drugs. And then for people who already have pre-existing mental health conditions, it can actually worsen those conditions too. Next slide. So, but there are things that we can do to maintain a good mental health. And here's some examples. And I always think of good mental health as ways in which we can flourish. And flourishing is about, being at your best even during difficult times, and then striving to be at your best even when things are going well. And there are like components of that we want to think about. So what are some positive emotions, or being engaged? staying in relationships or creating relationships, having meaning and purpose, and accomplishing different things. So these are some examples of things that we can do to manage stress during COVID. What are you all doing to manage your stress, or what are you hearing that people are doing to manage their stress during this time, the people that you're serving or your family members? So, of course, being kind and compassionate to one another. I always try to figure out one kind thing or more. I'll post it on social media and ask people, hey, kindness is free, pass it on. Staying connected with each other. Again, we may have to physically distance, but one of the things that we want to try to do is stay socially connected in a variety of ways. It's also, we're not in this alone. We are all in this together, and we are here to support each other. How are you all supporting each other, either in work or in your communities, in your neighborhoods, or in your families? You can also type that in the chat. And then doing things like finding your inner peace and trying to do mindful breathing. Like mindful breathing can be breathing in a square. Like think of a square and you go, breathe in 4, breathe out 4, breathe in for 4 counts, breathe out for 4 counts. What are some other things that you guys are doing? I see taking walk with friends, calling and texting loved ones. I've been paying attention to my little garden on my balcony. I have a little garden on my balcony. Somebody's talking about older parents being isolated. How do we connect with those folks who are older, who are isolated? Reading books, watching shows and movies. Awesome. Doing FaceTime with people. Great. These are great answers. These are all things that we want to think about when we're trying to maintain good mental health and emotional well-being during this stressful time. Okay, next slide. So there are other healthy habits. So let's talk about some of the other fun things that we're doing, healthy habits that we're doing. Some of them are around helping others, and that can be in your work, finding satisfaction and meaning and purpose by helping others in your work. Things like donating blood to a blood bank. And then there's things that may be more individualistic to how you're spiritually connecting or listening to music. I like sort of dancing around my apartment, and I am in here by myself, so it's all good, and I don't have to worry about who's looking at me. So learning a new skill. What are some things that you all have, what healthy habits have you all been engaging in to, again, maximize your mental health? Oh, great. I see keeping kids connected with peers versus be a messenger for kids. Staying physically active. Oh, somebody got fish. Yeah, fish is really good. They say that fish can help lower your blood pressure when you're watching them swim around the bowl. These are great. These are super duper healthy habits. Thank you for sharing. Oh, somebody's using Calm app. Excellent. Praying. Great. Oh, thank you for putting all these ideas in. I hope people are reading these ideas and getting some that they might try themselves. Okay, next slide. You can also share these ideas with people that you're serving. So we have a lot of resources as well. It's not like we have to think of all of this stuff off the top of our heads about anything related to the pandemic. So I'm going to turn it over to, I don't remember if it's Anna or Leslie, who's going to talk about some of the resources that are available to us during this time.
That's me. This is Anna. Next slide. So we know that there are, thank you so much, Kara. We know there are a lot of people who are struggling right now, as we've seen in some of the chats, but we also know that people are really in need of resources, whether it be that they don't have a doctor or health insurance, or they don't have access to food and need to get enrolled in CalFresh, or they don't have childcare and they need to go back to work in person. So I just want to review a few places to find resources or to help the people that you all are working with find the resources that they need. So the first one is getting help with healthcare. I mentioned this earlier when I was talking about finding a doctor. If you call 211 and say you don't have a doctor or a regular healthcare provider, they can help connect you to one. You can also find care near you at the Department of Health Services clinics. There are more than 24 clinics that we run at the Department of Health Services. And there are dozens and dozens and dozens of community clinics out across LA County, in every part of the county. If you go to the Department of Health Services website that's listed here, dhs.lacounty.gov, there's a button called Find a Clinic. And by clicking on Find a Clinic and typing in your address, you'll be able to see all the clinics that are nearby. And all of those clinics, you can call and find out if they're taking new patients. And the clinics can also help people get enrolled in Medi-Cal for health coverage. People who don't qualify for full Medi-Cal, likely because of their immigration status, may be able to get free health care through My Health LA. And My Health LA is a program that is a health coverage program for people who don't qualify for Medi-Cal. And through My Health LA, people can get care at health clinics throughout LA County as well. I listed here the address for web address for My Health LA. You can also call the phone number, and that gets you to member services. And there are people in English and in Spanish, people who speak English and speak Spanish who can help people get enrolled. Next slide. Getting help with food, cash aid, and Medi-Cal. So the place to go for all of this is the Department of Public Social Services, another county department. They can help with job services, cash aid, Health Fresh, homeless services, and you can apply for benefits through DPSS. There's no wrong door approach. You can apply by phone, in person, or online for many of these benefits. And the website is, again, available in English and in Spanish. Next slide. Great. All right, so that covers healthcare and cash aid and food, but there's also a lot of other community resources. Like I mentioned, child care or immigration, employment, financial aid. 211 can help with some of this as well. And there's a new resource that many of you might not be available with, or acquainted with, called 1 Degree. 1 Degree is a nonprofit organization that the county contracts with that has tons of opportunities and resources available listed by geography. So again, you can type in your address or listed by topic, and you can look up what's available, and then it's constantly updated. Another place to look is just our county website. The COVID-19 LACounty.gov website has all kinds of new opportunities available for people, and it's divided by workers, employers, residents, people experiencing homelessness, seniors, and more. So these are all good places for you all to look when people need help. All right, next slide is getting resources and help with mental health. So let me hand that back over to Kara.
Okay, great. Thank you. So we talked previously about our mental health and emotional well-being and talked about some of the things we can do ourselves in order to support the stressors and feelings that we have that may be impacting our mental health. But let's say that you need a little bit more help, or maybe you're living alone and you need somebody else to talk to. So if you need to talk to someone about your mental health, you can call your doctor, of course, and then you can also call the Los Angeles County Department of Mental Health, which is our access center or helpline at 1-800-854-7771. Now that line is great for the people that you're serving. So when you're out in the community or you're providing services to folks and they're saying, oh, I need a little bit more help, like, in the evening, for example, or, sometimes you're not available and I really need to talk to someone, they can actually call this number and ask to speak to the emotional support line. And that's a line where it is like active listeners, the people who are empathetic and listening and being able to support those calls. And if they need any more extra support, it would be the access center that would then help them to get connected to services straight away. But if you know also someone who is struggling with drugs or alcohol, you can get help by calling 1-844-804-7500. There are a lot of mental health and well-being resources on our DMH website, and it's really easy to get to. You don't have to go running around and trying to find it. So it's right there at dmh.lacounty.gov / COVID-19 information. And we also have partnered with a larger group of, I would say, vetted folks with Psych Hub. So you can also find more resources on psychhub.com / COVID /19. Okay, next slide. So now this line is actually for LA County employees, you guys. And, we recognize the great work and hard work, and I would say heart work, HEART, because the work we're doing is coming from our heart to help people during this extraordinary time. And we want to make sure that you have a place that is confidential and safe where you can go and, be able to have conversation about things that might be on your mind in order to take care of your mental health and well-being. And so we do have a new well-being line for Los Angeles County employees. It's available 7 days a week. The number is 833-307-0509. And this line is, though it is the Department of Mental Health line, it is actually operated through UCLA to ensure that people feel comfortable, safe, and know that it is confidential, the conversations that they have with the call agents that are responding to the calls. So I hope you all will keep that and use it for yourself, and the other numbers, of course, be able to share with the people you serve. So next slide. Yeah, what can I say? Together we can slow the spread. And I'm just so happy that so many of you have joined us so that we can share this information, that you also can share the information with the communities, with your friends, with your family, with the people you serve, so that we as a community can really work towards slowing the spread in LA County. We know the work that community health workers, peers, and promotoras do, and cannot thank you enough for all of that work. And I guess are we going to open it up to questions at this point?
Yes.
Great.
And I see that we already have some questions that came through the chat. Kara, since you're speaking, to you, one of the questions is can DMH contracted staff use the well-being line?
Yes, certainly. Please do.
Sorry, I'm reading another. Go ahead.
Okay. And there's also a veterans line. So that access helpline number that we provided, the 1-800 854-7777, that's the entry point into 3 different options. Access for more critical access to mental health care or crisis services, the emotional support line, which is the empathetic, active listening call agents, and then the third line is the veterans line, which is for veterans and military folks and their family members. And you just need to dial that one number to get to any of those 3 options.
Awesome. Thank you. I also see that Marina Barrios has her hand raised. Do you have a question or comment?
Yeah, I do. Can you hear me?
Yes.
Okay, great. I was just reading an article the other day that COVID-19, they're saying that now that, the new research is that it's airborne, and so as they were saying before that, the 6 feet distance and the mask was really good, but now new research is that it's actually airborne. So if somebody sneezes, it can stay in the air and it could reach, further than the 6 feet. I was just reading an article about that the other day. So I wanted to know if you know anything about that. If you can expand on that, I would appreciate it.
So
go ahead.
This is Anna Gorman from DHS. I'm sure, Leslie, you might have more to say. The CDC posted something about that being airborne and then immediately backtracked on it and took it down. So I think the research is not conclusive yet. and we do not, the CDC said day before yesterday that the guidelines it posted on coronavirus airborne transmission were wrong. So I think there's still a lot that we're learning about coronavirus, and I think there's constantly new research coming out, but that's the latest on that.
Okay, great. So you're saying that they basically backtrailed on that article that they sent out. I didn't read the article backtrailing on that.
Correct.
Okay, one, that's good news right now anyways.
Yeah, that's not to say we don't know. We just don't know.
Right.
Yeah.
But that's what the CDC is saying now.
Okay,
All right,
great.
go ahead,
Thank
Leslie.
you.
Yeah, thank you. You covered it. Do we have any other questions? Anybody wants to speak up or wants to type into the chat? If we don't have any other questions, we can end. So as we said in the beginning, this training is being recorded, so you will have access to the slides and to the recording shortly within the next few days. And we really appreciate you all being here. So thank you for joining, and we hope the information was useful and that it can be taken out to the community.
Leslie, I'm sorry,
yes?
before you finish, I typed in it. This is Anna again from DHS. I typed in the answer about the return to work, but I just wanted to make sure I say it here too, because there was some back and forth on it in the chat. A negative test is not required for return to work. So I posted in the chat the guidance from Department of Public Health on that. So definitely make sure and take a look at that. And then I just wanted to share one thing that you all are a really, really critical workforce. The community health workers, promotores, and peers at community organizations, community health clinics, and at a county are really, really important to stop the spread of coronavirus. So we really hope that you will get this information out to your community as you're doing your day-to-day work, that you can share this with people and help us work together. Thank you so much. Leslie, back to you.
All right, thank you, Anna, for that. So, yeah, thank you, everybody. Hope you have a great rest of your day, and you'll be hearing from us shortly with the materials.
Excuse me. Hello. Can you hear me?
Yes.
Yes. I'm so sorry. My name is Anissa Muhammad. I'm a senior community health worker at MLK, and I was with a couple of patients on the phone, and I lost track of time. Please forgive me. How soon will we be able to have access, or how will you contact us with regard to the listening to the recording?
Sorry. No worries. We'll be emailing it out.
Okay.
So however you got the information for today's training, they'll be emailing it.
Okay. Thank you. I'm so sorry.
No problem.
No worries.
No worries. Thank you all.
Question. So for those of us that got the information through our coordinators from SPA 2, you're going to send it to them and then they'll forward it to us?
Yes.
Oh, okay. Okay.
Yeah. And then if you want to, you can add your email to the chat box and we'll make sure to add you as well. But if not, then we'll just send it out to whoever we invited so that they can send out the information. So it'll get to you.
I'm adding it to the chat just in case.
All right. Thank you. We appreciate it. Thanks, everyone. Have a great day. We appreciate you being here and we appreciate your work.
God bless. Have a great day.
Thank you.
Yeah.